Okay, so let's see a patient. Oh, that's not you?
Yeah. Oh, I thought you.
You're Dominic?
Yes.
Okay, that's you.
All right.
So Dominic is 52. His main complaint is right eye waters, tears, when he eats. Post-Bell's palsy 5 years ago. Eye also tears with light pressure on left stomach 29 area. So it's the right eye and left side. You're a writer and a poet.
Yes.
Nice. You had asthma as a child, adenoids removed, eczema, which cleared in your 20s, bronchial problems, sickle cell disorder, led to right eye operation on the retina, cauterization of blood vessels, which led to loss of sight in right eye. Okay. Interesting. Sickle cell disorder, as in sickle cell anemia?
It's very similar.
Very similar.
But not as, the symptoms are not as bad.
Okay.
But it's very similar.
Oh. And you have very thick eyeglasses.
Yeah, but that's...
Well, one side is very thick, or
No, well, it's just, these are like, I broke my other ones.
Oh, okay.
So these are my sports ones.
Oh, and your right eye is kind of a little bit...
This is the one that works.
This one? Yeah, I'm talking about this
Oh
one.
yeah, this one. I've got detached retina in this, and it doesn't work at all.
Ah, okay.
But it's also the one that waters.
Hmm?
It's also the one that waters when I eat.
Yes, I understand.
Yeah.
And the detached retina, there's nothing being
to
offered. Okay. You don't see anything to
Nothing from it, no.
Okay. So that okay. So that was the childhood. So when did this? So wait a second. So the right eye operation for the retina was done. Why did they do it?
Basically, with the sickle cell disorder that I have, one of the main issues is with the eyes.
Mm-hmm.
So the blood vessels in my eyes were very weak, so they were leaking. So they gave me a lot of laser surgery to seal them up. It was a very experimental procedure. So they basically said, like, we don't know how much to give you. If we give you just enough, it'll be, it'll be fine. If we give you too much, the downside is the retina will detach. So they gave me just enough in this eye, and this eye was too much.
Ah, it was to both eyes.
So
and
yeah.
when was this?
This was 1997.
Okay.
So yeah.
Okay. So you were, say, about 20 then? 20 something?
22. No, I was about what? 27?
Okay.
Yeah, 27.
Right. Yeah. It just was put all under childhood.
Yeah.
And at age 29, you started getting allergy. Allergy testing led to dropping wheat and dairy in a diet. No. Childhood allergy problems all cleared at that point.
Yeah.
And then you had Bell's palsy at age 47, that's 5 years ago,
Yeah.
on the right side, and the right eye started tearing when you eat.
Yeah.
When you eat, okay. And family history is prostate cancer by father, and the siblings have back and hip problems. Mm-hmm. And you eat mostly rice and chicken with occasional broccoli.
My vegetable intake is getting better.
You have broccoli and what else?
I've never been a mad
Two
fan.
carrots.
I've never been a mad keen on vegetables, but I'm trying.
Well, no. It's just very unusual. Rice and chicken.
Yeah.
With occasional broccoli. So you eat now. Not vegetables, but no fruit.
Yeah,
and because you don't, I understand, because you are boiling wheat, so that's why it became so restricted.
Yeah.
Okay. Sleeping is okay and energy is up and down. Okay, so right side eye, and originally, so there's the sickle cell business, there's the asthma, eczema, and adenoids, which are all immune issues. And, and it's tearing when you press this, So Lawrence found out that if he presses on stomach 9 on the opposite side, on the left side, the right eye tears.
Yeah.
Okay. Now, literally tearing, or you feel tearing?
No, I feel it and it tears.
Okay. Do you have shorts underneath this, any chance?
No, I don't have shorts, but these are quite loose.
Okay.
So I can...
Okay, so if you don't mind shoes and socks off and shirt off, and we'll put you on the stable, head here, face up. So since age 27, this eye is blind totally.
Yeah.
Gotcha.
My t-shirt come off.
Yes, if you don't mind off, that'd be easier.
Head there.
Head here, face up.
Face
Face
up.
up, yes. It's always a dilemma. Which way is face up? And lift up. Okay, good. Comfortable?
Yep, fine.
Relax. Why is it, it seems like that to me, I may be wrong. It seems like this calf is quite a bit bigger than this
Yeah,
one.
it is. Yeah,
What's the story?
The story is the one leg is the story is
Come on, make up a story, David. You're a writer.
I wondered myself, and the older I got, the more it seemed to like. So I think it was a posture issue, and then basically I went to have a lot of nerve tests, and they said that the nerves on this side of my body, the nerve, the impulses travel slower
Yeah, okay.
than this side.
Okay. Interesting. Why did they do all these nerve tests?
Because I went in and I said like one of my legs is.
Oh, purely for that?
Yeah, I
Gotcha,
said like.
It wasn't some disorder? Okay.
No, I wanted to find out what's up.
Yeah, okay. Any discomfort?
No, it's fine.
Any discomfort?
No,
Any discomfort?
no.
All right. So, when I press here, you just feel my fingers. Okay, if you feel anything different than just my fingers, just let me know, okay? Anything weird? I don't think that feels like this.
No, it feels different.
Right. So that means something's there. It doesn't have to be pain.
Right, okay, yeah, it feels different. Yeah.
Okay, so something here. How about here? Here.
That feels different to.
This one also.
Yeah.
Okay. How about here?
That's all right.
Here. Here.
That's all right.
Okay, wait, compare. This side and this side.
It's different.
They're different. Okay.
Yes.
When I pinch,
They're different.
they're different.
Yeah.
Okay. If they're different, it probably means liver is the problem. Okay. So anything here? No. 17. So up to now we have this one, and this one. Correct?
Right, I can feel my eye beginning to water.
When I press here?
Yes.
Okay, okay. So that's a good you can feel it beginning to water.
Yes.
So you're sensitive enough, so it's a good test for me to try.
Yeah,
Okay,
yeah.
fair enough. And I believe, according to, okay, hold on, before I check stomach 9, okay, relax. 1, 2, 3, 4. Anything? Any discomfort?
No discomfort.
Okay. 1, 2, 3. The cervicals. No. 1, 2, 3, 4.
That's all right.
1, 2, 3, 4, 5.
What one's that one?
Occipital. I checked the occipital and cervical. Okay, so nothing.
Nothing.
Okay. Any discomfort? This one, it looks like. You made a face when I did this. It's okay?
Yeah.
Okay, I'm just asking.
Yeah.
All right. So, all right. Any discomfort here?
Well, that feels different.
Different.
Yeah.
Lung 10.
Lung 10. How about this one?
No, that does not feel the same as when you do
Right.
it on the other side.
So, would you call the left side normal and this side not so comfortable or something? Would you consider this one the normal side or this one the normal side?
I consider this one the normal
You
side.
think this is normal?
Yeah, yeah.
Okay, that's what I want to know. Okay. And how about here?
That's okay.
Okay. Lung 10 is called UG, the fish border. Okay. Fish don't close their eyes. Okay. So his eye is much more closed. So maybe lung 10 can do a good job for him. Okay. It's just one of those things that that you can think of as a possibility. Okay. But the main thing. Okay, we know liver relates to eyes. So this makes you eye tear also, right?
Mm-hmm.
And I only have to press once and you can feel it.
I can feel it, yeah.
Each time I press, you feel it very clearly.
Yeah, yeah.
So if I can resolve this, and then I believe if I press here, the same thing happens? According
Yeah.
to Lawrence.
Yeah,
Yep,
yeah,
yep.
same thing happens.
Okay.
But
Is it clear right now?
when you do it the other way,
This one.
that was more pronounced.
This is more pronounced than this?
Yes.
Okay, so I have two things to check. This is the better one.
Yeah,
More
okay,
clear one.
yeah.
Okay.
So
fair
which
enough.
one, sorry, which one were you pressing?
Liver.
Okay.
Left stomach 9.
Left stomach 9.
I know this from Lawrence, not from me.
Oh, I
know.
see.
So, all right. And by the way, anything up here?
When you press that one,
Yeah?
that is different to when you press other plugs.
No.
Oh,
I'm not talking about this.
right,
They're not equivalent.
right, okay.
Is there any discomfort here?
No.
You were going to compare it with something.
It feels when you press that second time, when you press there,
This one.
yeah.
It
It
feels-
felt you were pressing harder than that other time.
Ah, okay. So let's assume. Okay. So this
Yeah.
feels like I'm pressing harder. Meaning I know you. We will call it there's pain here.
Right, yeah.
Because I'm supposedly pressing the same way all the time.
Yeah.
Supposedly. Okay. So we'll call this there's something here.
Right.
Okay. The upper SCM relates to eyes also. And I have to look at the sickle cell business. Okay. So
Harvey,
yes.
would you just indulge me and just test the visceraptosis? It's just a postural observation.
Yeah, I understand. Anything? Anything? No. 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 I think the reason why not as likely, I know what you mean. He's quite lordotic
Mm.
in his posture, but he's a little too compact. He has the capacity to hold. If he was a little lankier, for his size, if he was lankier, then it's more likely.
Mm. Mm.
But given that he's kind of like, he's a little bit like a footballer, so he's not likely to develop this. If he was like a basketball player type style body, with that posture, you would say, oh yeah, of course it's going to fall. But with a compact body, it's not likely to fall so easily. Does that make sense?
Yeah. Yeah.
Were you testing on the crease?
He asked me to test visceraptosis.
Just remind, please.
Visceraptosis meaning everything falls onto the inguinal
So
groove.
it is on the inguinal.
Because he's had his hysterectomy and 11 children already and everything's falling down.
Right, thank you.
All right, talking about this one, both the feeling here and the eye, okay? How's now? It's a specialized liver one, yes. Hi.
Right.
What's going on here in the liver
Yeah.
and what's going with the eye?
Well, the eye was tearing up, definitely.
It's still, okay, so it didn't do anything for the eye. What about for this area?
That doesn't feel as...
It helps that area but doesn't help
Yeah.
the eye. Okay,
Yeah.
fair enough. How about now?
I think the eye's getting better.
You think the eye's getting better? How
Yeah.
about the liver area?
It's not as, is there supposed to be different in pressure or the same amount of pressure you're adding every
Sorry?
time? You're supposed to be adding the same amount of pressure every
I'm
time?
always pressing the same amount. Trust it. Assume that that's the
All
case.
right, okay. That feels lighter.
This feels lighter.
Yeah.
And the eye feels better.
Yes.
Okay. How much, I know that's a very hard question to ask. How much is left in the eye? How many tears are left in the eye at
Right.
this point? If there were 10 tears, how many are there now? Hmm?
I'd say that's definitely a improvement of about, I don't know, 20%?
Okay,
15?
20. Okay, fair enough. No.
Was that in a year?
That was liver 9.
Oh,
How's now? I'm checking gallbladder 39.
Something's happening, but
Something's happening.
I can't describe it.
Okay. Do you like the eye now better than you did before? How about now?
That's weird. Do that again.
Like weird.
The left eye is doing something,
The left
as
eye
well
is
as the
doing
right eye,
something. Okay.
but I don't know what it's doing.
Okay, hold on.
So that was spleen 9.
Spleen on gallbladder 39 because he does not quite have a wiry pulse classically, but he has enough to make me wonder. Okay, you said if I press here, this is the place where I press and the right eye is uncomfortable, is tears up?
Yeah.
Okay, that's happening right now?
Yep.
Yeah, okay. Is that also immediate, just like with the liver?
Yeah.
Okay. How's now? Spleen 9.
It's no, I'm not getting any tearing.
Not getting any tearing. Okay.
And that's sternocleidomastoid muscle.
That's the stomach 9 area.
Oh, stomach 9.
On the left side. Well, we'll call it stomach 9 because, Lawrence calls it stomach 9. Why should we call it something different? Why should we have another name suddenly? How about now?
The left eye and the right eye are tingling.
Tingling. Do you ever have tingling in the eye before?
No.
Okay, hold on. You have discomfort here, right?
Uh-huh.
Okay. How is now?
Is that spleen 9?
Yeah.
Yeah.
No. How's the pressure being here?
Pressure, there's no
Forget the eye.
pressure.
Okay, I wasn't asking about the eye. This
All
didn't
right.
relate to the eye.
Okay.
This is the fish border
All right.
that doesn't close his eye. It has nothing to do with
Right.
your eye. It
When
has
you-
to do with the fish eye.
This time when you're pressing that,
Mm-hmm.
it is not painful.
Okay. These damn writers, they have to create a poem for every question.
Why
Yes.
do you think it's spleen 9 of other something?
I know. It's not explain. Give me a chance. Okay, so relax. It's always going to come to the same damn thing with me, okay? Lung 10 you can fix by protocol with lung 5, lung 8, right? Metal water. Fine. But what is his constitution? There is something that's not, as it happens he had asthma, so I can say the lung, yes, I could use that, I could go there. But I'm saying, the first thing that came to me when I'm taking the pulse is, there is something that's like a wiry pulse. It's strong. It's not a full wiry, it's not a total wiry pulse. Like if you took it, you would say it's slippery. But it's strong. There's an aggression in the pulse. He has a symptom in the eye, which is it's part of the brain, let's call it, okay? So remember I told you that if they have strong wiry pulse, I use gallbladder 39, spleen 9. Okay? So I'm trying, now spleen 9 is not tie in and tie in.
Uh-huh.
connection. So that's one. I want to see if my basic, if I'm going to declare him to be a spleen 9 gallbladder 39 type, because of the pulse, which is not 100% clear, I have to be damn sure that these points do really good for him. Okay, since doing it on the liver, I got mixed results. It's good for the liver, but the eye is tearing. No, the eye is not tearing, but the liver is not great. I mean, it was all slightly confused. It seemed like it's doing something. I'm testing against other things. Okay, you have pressure pain here. And now when I'm pressing spleen 9, no poetry. How is lung 10 now? How's this one?
There's no pain there.
Yeah. It confirms, because there is absolutely no connection between spleen 9 and lung 10 through any dogma, except the fact that they're both Chinese, granted. But in my world, I'm using spleen 9 because of the pulse. If it happens to fix other things, it means I was correct.
Okay. So it's come from your pulse.
It's a confirmation, yeah.
Yeah.
So, gallbladder 39, spleen 9, I know that liver, okay, so I tried this liver one, which is for red eyes. I'm also going to try some other liver, just normal liver one. Okay. So this one does the eye, right?
Mm-hmm.
Okay. How is now? How's the rib?
Rib is it's okay.
Okay, and how's the eye?
The eye is something's happening, but I'm not sure whether it's tearing or not tearing.
Okay, well, better than being sure that it's tearing, granted. Not sure, is it good not sure or shitty not sure?
No, it's a good not sure.
It's a good not sure, okay. Sometimes it's moving in the good direction. Sometimes not everything can be described. It's hard, especially if you're a person that likes words.
Yeah.
So it's hard for you to not be able to describe things. I get it. Okay, so let's get him started.
In this case, Avi, would you ever consider looking at gallbladder 37 because of the eye
because it's supposed to
connection?
be good for vision, right?
Yes, and
Yes.
the liver connection.
Sorry?
And the connection with the liver.
Because
Because
37 is the lower point or something?
It's generally a point used for sort of eye disorders that might relate to liver, and the gallbladder is the paired channel of the liver, and there seems to be some connection on this right side.
Okay, I have no idea. I would assume that gallbladder 37 is, I believe it's the lower point of the gallbladder, and therefore it's supposed to relate to the liver. That would be
But
my...
what's his name? Is it Guanling?
Guanling, yeah. But the thing is, instead of Guanling, I can use Xuanzhang, gallbladder 39, and just my experience is generally better, but also because I was looking for, but I'm happy to try 37 instead. Okay. So, this is eye tearing. This is what got, so we'll try and do it quickly, just tell us what's going on. Is it better, the eye better, or the liver better? Or both better, or neither better?
Yeah, they're both better.
Both better, okay.
Yeah.
Compare for me with this.
This time round here,
Yeah,
that was more, that felt like more pressure.
okay, it feels, and what about the eye?
Same.
The eye is still tearing,
Yeah.
okay. So unfortunately, you know...
But not a lot.
But not at all. But it sounds like this one does a better job.
Yeah.
Okay, so the body says gallbladder 39, what can I say? Too bad.
Does 39 still reduce it if you press on the stomach 9 area?
I believe, okay, this one, it was from this spleen 9 I could get it, so here the eye is tearing also, right? Eye, correct?
Yeah, yeah.
Okay, now I'm pressing on this side, gallbladder 39. How is this now?
That's better.
That's better, okay. So I wasn't sure if it were cross sides or not.
Strong correlation.
Abby, can I just ask a question relating to what you were saying earlier about blueprint?
About what?
Blueprint, you know,
The charm,
yes. But,
Actually, would you mind waiting so we
But I was
Because it's not related, is it, do you think it's related to him
No,
directly?
no, because I
And that's
wasn't
the same
wondering,
national waste
I was
policies
wondering.
being on the other side.
You are not wondering, but
That's only talking about the like emotion and things like that for the blueprint one. Not like, okay, this could be the gene things or blueprint things.
they're different, no, nothing to do with
different.
genetics, nothing, no.
Okay.
This is, this is the idea that you are sent down to this life with a
Yeah.
blueprint. Nothing to do with the physicality of genetics or, no, different concept of,
'Cause
I
wasn't
can
sure.
see how they
Yeah,
relate,
sorry,
yes,
yeah.
yeah. So gallbladder 39, you take very much behind the, very close behind the bone. And upwards, superficial upwards, and a fair amount of the needle goes in. So you can see, usually the needle is, I just insert a little bit, but this is at least half an inch in. I prefer to start needling on the left side as it happens. So you'll see I always put the patient so I'm on their left. It's one of those habits I've developed. And spleen eye also, by the way, same thing. There's a fair amount of the needle in. I know for TCM it doesn't count for anything, half an inch. But for me it's a lot. Okay? And superficial. Kind of like the way you needle lung 7 or so, something. And I'm just going to flip this up. This didn't come out as parallel to the skin as I would like it to. How are we doing here?
We're doing good.
We're doing good. And the eye's doing good?
Yep.
Great. And you had a little bit here and a little bit here. That's just pressure pain. Nothing to the eye.
That's all right.
Okay. And how's Mr. Stomach 9 on the left?
That's okay.
How is this?
That's fine. That doesn't feel like
Okay. So,
We feed Dominic chicken and broccoli now. Rice and see if his ideas.
oh. Anybody have any lunch left? So, but I still, okay, so now we're taking insurance, so to speak. Oh, the other thing is oh damn, I should have checked large intestine 14. Have you checked large intestine 14 on him?
Nope.
No. Because it fits both liver and eyes. Damn.
What about checking on back point, just if there's any tender back points?
Why not?
Could you just ask how far you...
And I still have to do pericardium 4 on him because sickle cell, yeah.
How far up did you go for gallbladder 39?
Hmm?
How did you find gallbladder 39? Slide and...
I slide until
Slide
I
and
stop.
stop, okay.
It's everything is slide and stop.
Slide and stop, that's
Any
fine.
discomfort. No.
So maybe discomfort on the blood
Okay,
channel.
hold on. No? Okay. Okay. Anything here? No, he had nothing here. Okay, and he had nothing in the back either. Okay. Well, we still have to do inner liver 9 on him because it helped the eye. And I still want to do pericardium 4 because because sickle cell, like sickle cell anemia, any kind of blood disorder, I use pericardium 4.
Okay.
So.
Say the same with ordinary anemia.
Yes, but ordinary anemia I add, is spleen 6 also to build blood. Sickle cell is not lack of blood. Sickle cell is like shape of blood. So it's so that I can get away without spleen 6 and just leave spleen 9, but with regular anemia. And relax. Guardian 4. So 3 fingers. In this case, it's a little slide. The slide only came to 2.5 fingers. Anybody has any broccoli? No. Oh,
You want
I mean,
to test
it doesn't have to be on the table, but eventually I want to be able to. And liver one also helped, by the way. Okay. No, because I know there's cookies there, but he doesn't eat wheat. So
I
we
have
can't.
strawberries.
You have strawberries. Do you eat strawberries?
I eat strawberries, yeah.
Okay.
Why?
We want to see if
No, not now. At the end, when he gets up, no, I don't want him eating and lying down, feeling like. Sorry? No, because the liver's only on the right side.
Oh.
So, last, you can relax, it's okay. So, this is okay, and I is okay when I'm pressing.
Yep.
Okay. This is okay, and I is okay when I'm pressing?
Yep.
Okay. Would you close this eye for me? No. Yeah, I see what's happening. Okay, let go. You don't need to do that. How do both eyes feel right now?
Both eyes feel very good.
Okay. All right. We'll let go for right now. We still have more to do on the back. Are you comfortable?
Yeah, yeah.
All right. Let's get you in, madam.
Okay, yeah.
gates of the channel.
Oh my goodness. Postnatal anxiety, catastrophizing. Yes, please.
So basically, I've got postnatal anxiety which started about a month ago. My baby's 5
Talk
months
to
old.
them because I'll hear
It's
more
really
easily.
creepy up here.
Because they're further away. I can hear you even though they're not facing me, but they can't.
Yes, it started with reading about somebody getting ill and like a cancer thing. So basically, there's like trigger words that set me off, like cancer and things. So it's related, I think, to
What other words?
somebody said lymphedema or something yesterday, and that set me off.
Oh, okay. Anything to do with cancer? Yes.
Yeah, it's to do with mortality, me dying or my babies, that sort of thing, fear of that. Yeah. Both my parents are quite fearful types and have suggested that there was something wrong with my son in the past because he's got a swollen lymph node that I've had checked. So that's always in the back of my mind as well. So, yeah. But I've had blood tests done recently. No problem with thyroid because they were looking to see if there was a thyroid-related thing. There's no history of thyroid in the family. So they were all normal. All blood tests were absolutely normal. But my, it was kind of like I was waking up in the middle of the night with the word metastasize in my head. Like it was quite, it felt like, yeah, how can you ask me? Something attacking. But my mum has a history.
Where do you feel it in your body? This attack?
Around here.
Around here, below the navel or level with the navel? That's a little hard to tell.
Below.
Below. Okay.
And awake on a morning
So
often.
you feel, if I feel fear here is a statement that makes sense to you. Okay.
Yeah. So I would wake on a morning and it'd be kind of there straight away, and I'd feel quite a bit of bloating, and then as the day kind of then evolved, yeah, I mean, literally, I thought I was dying.
Okay.
It was ridiculous.
This happened after you gave birth. It's all started after you gave birth.
Yeah, for about 4 months after I'd given birth.
When was the birth?
February.
February this year.
Yeah.
Okay, so it's about 2 months. You've had this for about a month or two.
Yeah, about a month.
Gotcha.
But I did
First
previously,
child?
it's my second.
Second.
I had previously, the year before when my other son was about 2, I had some health anxieties then when we were going through exam periods, and I didn't realise because we were learning about a lot of Western medicine things. It was a bit of like hypochondria then. As soon as I realised that's what it was, because there's apparently a condition, and then that was it. As soon as I realised, I was like, oh, you dumbass. And so, do you know what I mean?
Dumbass is a condition.
Yeah. With this,
But it's a curative condition.
and I know it's unrealistic, and I'm trying, and I'm managing it when it happens. But the fact is, my body still responds the same way, and it goes straight to worst case scenario.
Okay. And you have had endometriosis?
Yes, which had a.
And yet you've had 2 kids, no problem.
No.
Wow.
Read the next line.
Recurrent miscarriages, though, 5.
So I had endometriosis, which had laparoscopy for in 2012, and then following on from that, we had 5 miscarriages that were mostly at 3 months stage, so quite late.
So until 2012, you never tried to get pregnant?
No.
Got you, only afterwards.
Yeah.
Okay.
And then with my 2 pregnancies, I had to have injections of heparin every day. They didn't know that it's not known whether or not I really needed that or not, but the babies are here, and so the next time they said just do it. So yeah, it's a lot of heparin.
And food phobias in childhood with IBS at
about
5 years old, okay?
See, my father's a diabetic, he's type 2 because he's had long-term alcoholism, so there was quite a lot of stress in my childhood. And I think it just kind of, that's the expression it came out with.
So
I don't get ill easily,
but
I'm really sensitive to like drafts and cold, you know, like really round here, like now I'm feeling really tender kind of round here.
Okay. 2 car accidents, 1 to 13 years old, rolled 4 times with no seatbelt. Live near an open garbage.
There's an open
garbage
tip
what?
in our village. You know where they dump the waste? It's
Okay.
an open
Which
one.
has had some issues with leach into local water supply. Okay, I understand. Acne from 18 to 30.
Yeah.
Blood tests with.
That's just the blood test from last week.
Oh, okay. Okay. So thyroid is okay. In other words, okay.
Yeah.
And right ankle weakness in the past 2 months,
Yeah.
but has improved lots. Around bladder 60 and 62. Some dizziness and headaches
Since the anxiety began.
since anxiety began. Oh, okay. All right. Face up.
Just
for your
a bit,
knees. The thing is, her fears are lower jaw, so kind of describes this idea of rent-for damage. But on the other hand, it could still be rent, but she's had food phobias with IBS in childhood also, so she's had this gut thing before.
One of the miscarriages, when I lost the baby, basically my waters broke and the baby was stuck inside me. So I had to have an operation to have it removed, and it was a little problematic, so that might explain maybe something. But both my actual births were absolutely fine, no.
So obviously I do not have a reflex for fear of cancer. Okay, it just doesn't, I mean, no, it's a lot. Maybe if I worked in a cancer treatment center or something, I would have a little bit better capacity for that, but so I don't have, but we know that, do you feel anything just uncomfortable here?
Not too bad actually.
Not here.
No, it's slightly there.
Slightly there, okay. Stomach 28 on the right side. How about, on the left side. Stomach 30, right side, okay. How, left side. How about right side also?
One.
Okay, so stomach 30, stomach 28, okay. How about, okay. People who have digestive problems often with a whole palm around the navel. That represents small intestine. Sorry. Anything here?
There, yeah.
There, okay. So just below Ren 12, I would call it.
Yeah. I have noticed sometimes I can see when
Oh.
A pulsing. Yeah.
I don't feel the pulse now.
It's not always.
Remind me about Red 9 pulse to talk about that.
Can that be transient?
Apparently can. The thing is, what you feel and what I feel on my finger is...
I've physically seen it.
Yeah, no. Yeah, okay. Yeah, that's... Okay, yes, that you're seeing may not exactly be the pulse. It can be a quivering, it can be a quivering that the nervous system is quivering and may not actually be the actual pulse, what what you see often. It's sometimes related to your breath. So if your diaphragm, your diaphragm is stuck there.
Yeah.
Okay. Then you can see quivering because the breath isn't smooth. It's not necessarily it's a pulse, but it's not a pulse of blood. It's a pulse of breath, rather, I think. So definitely icky here. Okay, icky here. 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 And here. Okay. How about 1, 2, 3?
Yeah. 3 definitely.
3 definitely. It's 1, 2, 3.
Let's do 2 a little bit more.
Okay. Okay, and 17? Okay, and 15, I believe was okay. So, it's cold, it's not warm. Any discomfort? There, this one. So just to the left of, a little in front of 220, okay? So this one, and boom, boom, a little bit here. Okay. So we can start with the standard dogmas, spleen 6, spleen 9. Let me just think, there was something else. Oh, and there was this. Okay. This sometimes you can do with how's now? Okay, so I have some confirmation for spleen 9. The other thing is, let me see if...
Yeah,
Okay, all right.
I should know how to answer you by now. I'm not
It's
doing-
okay, no, it's okay. You're doing fine. And how's this going?
Yeah.
And is it here? And I press spleen 9. How's now? Gone. Okay. So I have my confirmation for what I want to do. My one thing that is possibly not likely to respond is this one. So I'll check. Hi.
No, it's all right.
Okay, it is. Okay. Okay. Well, it's going to want to be simple. It will be simple. That's okay. It's allowed. We don't have to make a big deal out of everything.
Will you put
We've had
liver
enough
8
vasculitis for one day.
Will you put liver 8 in just because of history?
Liver 18?
Liver 8 in, sorry, will you need it?
Oh, no. It's endometriosis. Hold on. Yeah. I have to check liver 5. I'm sorry. That was.
Oh, liver 5, that would do.
I'm so sorry about that. So you have stomach 30 and 28, correct? When I press liver 5, I'm already seeing myself doing moxa there. I'm like, forgot to test. It's like endometriosis, liver 5. What the hell? It's like, who needs to test anything? Hi. Okay. And stomach 30. Okay. And it's here, right? Liver 5.
Okay.
Okay, good. And just this one here. Okay, so Chiho, this is one where you have, there's quite a few of them. So you can feel bump, 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 bump. I'm going to take the top one.
This one?
But here, start feeling here.
Yeah. Is it a hold or because I've got a lot of people who's got a sort of bumpiness? It's
just like the stomach chi. Yeah,
Yeah.
but if there's a bump, there's a hole past the bump.
Yeah.
I mean, the question is it a bump or is it a hole? Do you know what I'm saying? There's a bump, then there's a hole. There's not a bump, there's a hole. Because when they have a bunch of them, you can't say which is which. When you have one, see, do this one. This one's very clear.
Yeah.
Just one. This one, there's a whole bunch of them, so it's like, who's a bump and who's a hole? We don't know. The whole area could be liver 5. Okay. It's good?
He's gone.
Okay. And how is boom and boom?
He's still there.
Okay, hold on.
It's okay.
It's okay?
Yes, one.
And above?
Cool.
And this one.
Oh.
Great. Okay.
Simple.
So we know. Yeah. So yeah, I would tend to take the higher ones
Yeah.
more likely. So spleen 6.
So in my book, because I've got history of cardiac and diabetes and endometriosis.
Oh, in the family.
Yeah. Like, how do you know which is the most
Because obviously, I suppose you'd consider cardiac type and those sorts of things, wouldn't you?
I didn't see the cardiac anywhere.
Yeah, my mum's got a heart.
Your mum's got a heart, I hope she does. Oh, God.
Yeah, she has angina as
High
well.
blood pressure, etc.
And her dad died of a heart attack.
Okay, so take this slightly out. Oh, good.
Does she have RIN 15 reflex?
No, I don't believe she did. No, she had to be lower in 10.
Yeah, there, yeah.
It's still there? Okay. Relax, I'm sorry. Any discomfort?
Yes, yeah.
Okay, so yeah, so for that I would, okay, so.
Are
Okay,
we
hold on.
SI 11
Sorry?
in the back?
Smart just 11, yes. So, I think, oh, you were reading this and then at some point, yeah, I think somehow I missed the mother thing. But yeah, your endometriosis is very important, and the possibility of the diabetes, I'm already doing spleen, so I'm relatively okay with that. The cardiac, yes, now that I find it in your body, I do need to address. But, hold on. Let me just see. Because before I do pericardium, because remember, it's lung plus pericardium is still missing for this stagnant blood in the head. If I do pericardium, I may lose the cardiac reflexes. Anything here?
Yeah.
Okay. And here? And 1, 2, 3. 2 and 3 and boom and boom. Okay. I can't needle into ring 4 because that's where the symptom is.
That's one that I get a really weird sensation of both my ears.
Oh, question. Maybe it's on John 22.
Yes,
How is now?
fine,
How is now?
fine.
How is now? And how is, relax.
Sorry.
No, because if you push up, I can't, I know, you want to help. How is now? Okay, so if I can't do Rent 4, I can do Mushu. Okay? So for cardiac, Rent 4 is very important.
So what was the reason you think you
Rent 4 and cardiac, this is small intestine and moo point. Small intestine and heart are one, you know, it's, sorry, I just...
We can't do it because we've got slow pulse.
You can't do it if you do slow pulse. In her case, it's not the pulse.
Right.
In her case, I can't do it because her symptom starts here. So even though she doesn't say pain, if I needle Rent 4, I mean, now she's going to say, it's not just cancer that scares me. Now I think I'm going to have, you know, a stroke. And you know, I mean, I don't know what's going to happen. If I touch this area with a needle, it's just like if it's inflamed, I don't touch with a needle. If it's like, well, why do you have, you know, it's like you go in and stir it.
Yeah.
Like, let it be, you know, just deal with it from afar. Much better. Okay. And which pericardium? How is pericardium 8?
Okay.
Okay, so now it's either 4 or 6. Okay, so you said it goes up to the ear.
Yeah,
Okay, any discomfort?
yes,
Tender? Okay. Pericardium 4. How's tender on gallbladder? Whatever, Sanjay, 21, whatever. Got fine? No, that's all I need to know. So do you see that if I really want to, I can move it faster. When I'm teaching, I don't try and move it too fast, but every so often I want to give you the sense that, look, it's not quite like you're going to spend 3 hours with a person. Like sometimes just keep moving. It's okay, you know. Anything here? On lung, I'm just checking for lung 5. And the reason I'm checking, I wouldn't have checked except she has a blood vessel right on lung 5, so I have to figure out outside the vessel or inside the vessel. Outside.
better.
Okay. So outside the vessel works fine. Because lung 5, I don't need to, you know, I don't have a reason to check.
So you were checking Sanjay at 16?
Around Sanjay 16, yeah, because it's related to immunity.
Immunity, yeah.
The lung would be related to immunity. So, next. Any discomfort? Okay. And 1, 2, 3.
pretty much.
No, like pretty much results gone, I'm not gonna should I check the pericardium status? And I'm like, no.
No.
Let's go. So notice that my lung 5 is more lateral than what many of you would have thought. Okay? All right. And cardiac symptoms seem to be okay now. So all we have to do is liver 5. Okay. So, may I have the This is fine? Yeah? A little bit? How's now? These two are good?
Yeah.
Okay, the only problem with liver 5 moxa, you need to do lots of it. Moxa good. So this is not a point where they should feel 6 or 7, they should officially feel 21. You know, in other words, lots and lots of moxa. Anybody who wants to do the other side, they're welcome. So make sure your hands are not sweaty. And just keep wiping them off and wiping them off.
I just realised that all that annoying stuff on the screen has gone. And I don't know how I've achieved.
Liver 5.
I just don't know how I've got rid of it. Yeah.
So tell us if it's too big. You'll feel like little mosquito bites. And so the only thing is you have 2 people doing it, one on each side. So tell us which side you feel that's too much, if it gets too much.
Try not to flare my leg around.
Hopefully not. If you do, you do. Try and make it with the right hand. If you have to. He's stronger. Sorry?
I've done a lot of moxa since I last saw it.
Good.
Okay. Not later then.
Hmm?
Not later.
So they
Well,
can
that's-
be, they can be a little
That was you, I
smaller.
think, sorry.
It was me?
Yeah.
Okay, sorry. Shut up and concentrate on my job. Questions?
Oh, that was.
It's gone.
Yeah.
Sorry.
I can handle it. I've given
Oh,
both
okay.
class.
Yeah, no, but don't, no, if it's too much, it's too much, because what happens is the next one's too much and then suddenly you're burnt.
Yeah.
So it's not worth it.
Ooh, sorry to interrupt you. Is it Tony? Tim?
Hmm?
Sorry?
Is it Tim?
Sorry,
Sorry, Tim.
what was that?
That was just. Sorry, Tim.
What's that?
It's got a bit like that.
Oh, yeah, that's really
Not good.
very unpleasant. If you can make them a teeny bit smaller, it'd be nice. I'm just suggesting, that's all. As long as the patient will be worse for the patient, it's good. Questions? When I do moxa, I can't do a lecture.
Can I ask?
Yes, you can ask, of course.
Last year you talked something about scars and our face got a bit, but I just wondered kind of if you could refresh my memory about the importance of scars when you treat
If
them.
there's a scar on a body and it's still showing, there's pressure pain on it or it's keloid, it might have, it's stopping the flow of the meridian, so to speak.
Right.
So what you want to do is, if there's pressure pain on the scar, you want to release it, but you can also check if the scar itself releases things in the body. And if it does, you could needle it, or moxie it, or whatever, or you could put diode rings on it, or if it's itself has pressure pain, you might need to release it, so you might have to find points that release it. So any scar that there is, especially if there's still any sort of what people would call anger in it,
Yeah.
you want to deal with it.
But if it's
Don't
if
ignore
it's
it.
not angry, then it's fine to ignore it.
If it's not angry, there's no pressure pain on it, and it doesn't release anything. I mean, no, well, yeah, if it's an old scar, blah, 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 and it doesn't seem to be related to anything, but if suddenly you see, oh, we have a scar here, and this point is related by theory to this thing which they have, you check the scar.
So, I mean, the reason I ask you, I've got a patient who's literally got a scar from run 17, well, sorry, not that kind, all the way down, and it's like about an inch wide. It's an old scar where she had a gallbladder removed, a long time back, like 40 years ago.
Yeah. So the whole Ren line, but the Ren line scar, okay, so this is what I was, the Ren line scar is just the Ren line, but you know where they really went. I'm less interested in that scar, although that's a big deal. I'm more interested in what's happening here. And if they open so much, can you imagine how much all kinds of instruments went there and fucked up stuff?
And it was only 4 months after she'd had a she'd given birth and by what do you call it, cesarean, that's it. So she's got a massive scar going the other way, so it's like a big cross.
Yeah.
So it's quite traumatic.
Yeah. Yeah, so it's worth checking to see. The thing is that she basically has the whole Ren line going. Where's that?
I was wondering for this case, if you would consider adrenals based on sort of that lower
I'm sorry,
abdominal.
start again?
If for this case you would consider adrenals based on the sort of lower abdominal area of that kind of fear, that kind of fight or flight.
Not really, because, I mean, theoretically, yes. You could, but she doesn't. Kidney 2 is okay. She doesn't show adrenal. So the fear based on the lower dantian, the weakness, that's what the motion is for. And on the back she'll have UB52. But to call it adrenal just because it's fear, that's to me is like going back to the TCM way of doing things, which is deciding up here without applying on the, without actually asking the body if it's true. The problem is not that the theories are right or wrong. The problem is more that you're just relying on theory and you have no way of confirming it. I want to be able to have some manner of confirmation. Otherwise, like, what do I know what's going on? Make sense?
And what about the ankle? Has the ankle been sore for the same length of time as your anxiety?
No, it started before it. The ankle, it's really, when I went back to work 3 weeks after having the baby, and I found that I was quite weak, and I kept taking on all the illness of whatever coming with me, and that seemed to be the start of it. I know it's a bit weird, but like when I treated somebody with period pain, and then I had period pain for 2 days, and I wasn't even having a period. But I took some steps to kind of sort that out, and it then got better, but it's just every now and then it's a bit weak and puffy down there.
So. Okay. Can we have you sit up for a second and check out your eyes, and then we'll talk. Oops, are you good? How are your eyes? Feeling good? All right, let's turn you over. You will get some strawberries at the end. If you behave, you'll get some strawberries. Anything? Eyes and stomach both, because when he eats, he feels steering. They both relate to T5. 1, 2, 3, 4. Anything?
No.
Any discomfort? How about 1, 2, 3, 4,
No, it's all good.
5? How about center? 2, 3, 4, 5,
Hang on.
6. Oops, this one.
Back a bit.
Hmm?
No. Press down again.
Okay, hold on.
No, it's okay.
You sure? A teeny bit even.
Just a teeny bit.
Okay,
Just a
which one?
teeny-
1, 2.
That one.
That one. That one. And he has what we call a valley back because of this posture. Okay. So here. How's teeny bit? Hello?
Hello?
Yes, how is this guy?
Yeah, it's all good.
It's all good?
Yeah.
Okay. UB32, according to someone, relates to eyes. It also relates to esophagus. Okay? So, I'm not sure if that someone is Manaka or, somebody. one of the,
Abby,
yes.
rewinding a bit, Sarah would like to know, does T5, why does it relate to stomach and...
The nerves to the stomach come from T5, if you look at the map. You don't do gluten because of allergies, right?
Yeah, yeah, yeah.
Okay. Anything here?
No.
Hmm?
No.
Hold on. No?
No. Stop.
Stop.
There.
Okay. Great. So this is liver, but what I'm doing here, okay. How's stop on the right side?
Keep going.
Hi.
Hi, yeah?
You had something here, right? Stop.
Yeah.
Okay. How is it now?
It feels, the pressure,
Uh-huh.
in terms of pain, on the right-hand side.
Yeah, I'm not worried about this side.
Oh, right, okay.
I'm only, because you told me stop here.
Yeah,
this
yeah,
side.
yeah, yeah.
I want to know, forget the left,
Yeah.
how is that right side now?
It's good. It's much better.
Much better, okay. On the left side, slightly outside the Wattos, between T11, 12 and L2, we have food allergy point. Because this is, the cisterna chyli is what takes the oils, the fatties, the fat stuff from the small intestine, and it's, and it's a lymph that carries it to the liver. That's why I'm checking it against the liver. And often food allergies will be related to this point. Okay? So
Can you describe that again? You said
it's
between T...
anywhere between T11 to L2, just outside the Wattos. And there's another bumpy here. So the Watto is here, the bladder line is here. It's sort of in between. Possibly. You're looking at something that's relatively close to the spine. But it's not quite the Watto.
And it's on the right.
No, you can do them on the right, but primarily it's on the left.
Oh, sorry, I'm getting left and right.
This is the
Yeah,
left.
so-
I stand on the patient's left when they're face up. I'm standing on the right when they're face
I'm a
down.
bit,
Can't do both.
Just because of the allergies, that led you to do that
Yes.
rather than the
Well-
bladder 35?
Sorry?
Because I thought you had a reflex on the liver, on the right, And you say that you could release that with bladder 35 on the left.
Yes, yes, I
Because
can.
of the allergies you went.
Yeah, but
let's
because
try
of the
this.
allergies, I was thinking, yeah, because if I was checking, did you see how I was checking and like really insisting to try and find something?
Yeah.
Because if I'm just thinking liver and eyes and he had on this side, I would just go 1, 2, 3, I'm done. Or maybe I'll go on the black, but this one I really, because I wanted to be able to find something for this point.
Okay.
So.
Did he say asthma as a child?
I believe so.
There's the Kiiko's book, there's talk about the asthma point. Could you show me where that...
I'm not sure. I think we're talking about asthma shoe.
Asthma shoe, yes.
Okay, same thing as autonomic nervous system shoe. You can call it autonomic nervous system shoe, insomnia shoe. So UB17, UB17, Nick, you may want to, he may split his rhomboid. So it may show, you went to your, so anyway. So UB17 or 16 because do shoe or guess shoe. And you're looking, see how there's like see how it almost like creates a little path here?
Yeah.
That's what we're looking at. That I would call it. But if you touch, you'll feel almost like a bumpy.
It feels like a touching some sort of structure just going that way.
It's no.
No.
Okay. Hold on. Oops. Sorry. Okay. But would you see that when I press? There's a reaction that goes like this. That tends to be the right point, but it doesn't show in everyone. But so if you just the other thing is people tend to like use their hands a little too strongly. Use your hand lightly to feel, and then when you come to something that's weird, then press into it. If you press all the way, besides the fact it's not so comfortable, but you're going to miss a lot of options. Okay. So just press lightly. And when you get to where you think it is, then move a little more.
Is going to be the same things on the other side?
Yeah. Presumably he'll have it. I would go a little further out, possibly to here. I think here.
And this is the long point.
This is the asthma or autonomic nervous system or the insomnia shoe. We did it on someone yesterday, I believe. I can't remember who it was, but there was someone yesterday. I remember doing it.
Can I ask
yes.
a question about that? You located that just because you wanted a reference point to... No?
No. It was the insomnia shoe. We located because she asked, nothing to do with here.
Yeah.
She has the right because she has the strawberries. Okay. The liver. So I'm looking for something in the liver.
Yes.
And I'm insisting on finding something on the back because I want to confirm my sister on a Kylie point.
Yes, that's
if
what I
he
wanted
had,
how to confirm that.
Okay, you normally wouldn't be that insistent because normally you would have more possibilities. Anything here?
No.
Because that's also, small intestine 11 on the right side relates to digestion, either liver, gallbladder, or small intestine. So I would find, because he doesn't have a lot of findings, I could confirm this against anything I want.
Okay, so you were just using that sore spot up here as a way of
Confirming
that.
Yes.
You weren't really interested in that other than
Not terribly, and I wasn't, it's true that he had liver on the other side, but I was doing it simply because it would have been, because he has so few findings, then I'm trying to find anything just to confirm points. That's all. Are you comfortable? All right.
Avi, I just had a general question. I've seen quite a lot on patients, it just reminded me where you were palpating there, sort of bladder 17 left area, that whole kind of muscle is quite built up and maybe spasmed and
you're talking about
lower
this?
down actually, more there, and it reminded me it radiates up to the scapula and it seems to be attached. I see it very commonly.
Oh, you see a lot of people who have this.
Yeah, especially men, I guess, more commonly.
So on the liver area but on the left?
Yeah, and potentially slightly higher up towards the sort of cardiac area, and I always wonder whether it was the sort of cardiac reflex. Not that he appears to have it.
No, well, I'll have to see because that does not quite ring a bell for me.
Almost
And
like the
also-
muscle is much more built up, but also quite.
Yeah, I
fine,
don't know.
yeah.
That it does have try do too, but I don't think it is, because what you're describing, it's if you describe the inner board of the scapula,
Mm.
that's one thing, that belongs to do too. But if you're describing here, like you're saying T7 area,
Yeah, it could be both, but yeah.
you know, and close to the spine on the left, I am not sure what that would mean. You know. All right, let's switch her. Is that good?
What's the corresponding point on the back, please, Abby, for Ren 4? You go Ren 4...
UB27 or UB26. If you're looking at it as small intestine mu, small intestine shu is 27. If you're looking at it by name, 1 yuan is Ren 4, 1 yuan shu is UB26.
Okay.
Okay, but how do you know the difference between 26 and 27? Yeah, exactly. Neither do I. All right. Would you mind turning over? I don't know. Never seen one, actually. Thankfully, I don't think I've heard. Yes, so body.
I've got the biggest pants on ever.
Hmm?
I've got the biggest pants on.
All right. So we know we're doing UB52 on her because she had this weakness here, but we don't know what else we're doing.
I've been getting quite a bit of kind of sensations up around this area, where you know, kind of like a tightness.
Here.
Yeah.
Can you transfer it to the other side so it would look like Nick's patients? Any discomfort?
Yeah, there.
There. Okay. So she is on autonomic nervous system shoe. Let me check if there's something on the right side. Yes, there is. Okay. So she just feels it more on the right, but it's also on the left. Okay. So we have a bunch of options. We can treat it as if it's liver, but then does it treat both sides? Or we can treat it as if it's ANS and then see if DO2 will do the trick. So let's start with DO2. How's now?
Fine.
And how's now?
Still a little bit on that one. Yeah, gone.
And this one also?
Yep.
Okay. And usually you check DO2 against the inner board of the scapula.
Yes.
1, 2, 3.
All three.
All 3. Okay. 1, 2, 3.
One still had some.
Sorry?
One still had some.
Only one.
Yeah.
Okay. Go further down. 1, 2, 3.
Yeah, that's okay.
Okay. And sorry, I think it was here and here. Is that correct? Okay. How is now?
Okay, still maybe a little bit on the left, but only a tiny bit.
And now?
Yeah, gone.
Okay. So notice I'm trying to take DO2 a little further up if I can, but I couldn't in her case. Why? Because patients just prefer that you mess around less. The higher up you are, even if it's by millimeters.
I'm glad I can't see the screen. That's good.
Yeah, no, but you know, it's not so. You just get used to suddenly DO2 is not where the textbook says it is. Suddenly it's where the patient wants it to be. Whether how far is the underwear line going to go, kind of thing.
You're putting that really high.
I did warn you, I've got really big pants on.
I usually am higher. I really am usually higher, and I'm like, but it wasn't going to work for her, and I had to keep going down, so it's okay. So, anything left here?
A tiny bit.
Okay, very good, very good. sorry. And this is tender?
Yeah.
Okay, sorry about this tender. I'll resolve it in a second. How's this guy?
Fine. Go.
Okay, so this guy, I want to see if I can resolve. Any discomfort?
Yeah.
Okay, right.
Is that GB 20, sorry, GB 35?
Smitus
25.
GB 25? Oh no, this is UB 52.
UB 52.
Any discomfort here? UB 60.
A little, but not. It's not too much.
This is how you change protocol. Protocol is the little you should have 66, 67. Not interested right now. Maybe I'll have to, but right now I'm going to try something else. How's the little?
No.
No, gone?
Yeah.
Okay, no means gone. Okay, just want to make sure. How's this guy?
Gone.
Gone. How's this guy?
Still there.
Shit.
Sorry.
It's okay. Give you vasculitis if you don't. How's now?
That's fine. Yeah, fine.
That was just a different angle.
Yeah, well, slightly different location. 36 can be a huge area. So I told you, support the support you cannot ignore. By the way, this 52 is okay?
No.
Oh, shit. But this one is okay?
Yes.
Okay. Thought I'd get away with just going for 36 without checking anything. So you see, you should always check. Hi.
Yeah, it's fine now. There's a little bit there.
Now, it's the angle of...
Still there.
No problem.
That's better.
Yes?
It's like 10%. Gone.
Gone?
Yes.
Now we can leave it. So UV 52 in towards the spine. Do you have anything, any discomfort?
Yeah.
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 Gallbladder 17 is called fear. Zheng Ying means to, kind of like to freak out. I mean, if you translate the two words, it basically Zheng means upright, and Ying means nutrition. But together, that expression means to kind of like go, "Grrr." Okay. So freaking out.
Yeah, that's tender.
It's tender. Shoot. Okay, sorry. But how is freaking out in the head?
About,
There's
about 30% left in it.
Okay, hold on. Now?
Yeah, that's it.
Okay. But is this painful?
It's tender, yeah.
It's tender.
Quite a lot.
Okay, hold on. If you can just, yes, thank you, that's very good.
That's tender.
Sorry, how is this one now, the top?
That's fine. That feels better than when you did the one on the back.
Right, okay. So freaking out. And how's the T45?
That's feeling better.
Okay, fabulous. Damn, can't choose disappearance. So ridiculous.
Do you want a
I
serum?
can't
Do
believe-
you want a
I
serum?
don't, yeah, get me anything. Yeah, serum is actually even better.
Everyone.
Are you holding the Sanjal 22 or?
This is not Sanja 22. This one is, actually it is. I thought it was further, I thought I would have called that gallbladder 8 maybe or something.
You release the pressure going on, freaking out. Is that the
Yes.
reason you use it?
And how's this now?
Still a bit there, but only about maybe 25%.
So you think 25%?
Yeah.
Small intestine 9-10 to the rescue. How's now?
Gone.
Sorry, could you tell me again what the point is on the
Small
spine?
intestine 9-10,
No,
sorry?
no, the one that you're trying to release on the spine.
T45.
T45, thank you.
Relates to the Shen, right?
And you often use small intestine.
9-10 to release anything between the shoulder
Yeah.
blades, yes. Yeah. Because it opens up the back. How are we doing?
Yeah, fine.
Good?
Yeah.
All right. Comfortable?
Yeah.
All right. Goes in my pocket. I tube. So I don't need, actually I won't need that one. All right. Strawberries are coming.
All this was strawberries. All this was strawberries.
You ordered some strawberries. Okay, let's have you sit up.
All right.
How are your eyes?
Yeah, feel good.
Okay. Sit up. Relax the neck. Oh, you're tight neck. Okay, look to the right. Look to the right. Now, slowly, don't do it yet. I'm going to ask you to look towards the left with your nose and your eyes. The whole head moves to the left. There'll be a huge stretch on the right side going towards the ear and the eye. You're in total control of it, okay? So, go to the left. Go a little faster. It's going to start now. Drop the chin slightly. Keep going. Okay, you okay? Just breathe. Drop the left shoulder. This one. No, not the chin, the shoulder. Let go. Push it, just let go. And sit straight. Look to the left. And now look to the right. Same thing is going to happen. Giles, is this explanatory?
Yeah.
Just want to make sure. Don't tilt you.
Okay.
Yeah, I know, it's escaping the stretch. This feels worse that way, I know. They'll do anything, like the head's going to go all over the place and they have no idea that they're all twisted because it's too intense, so they're trying to escape it.
Okay. What do you want me to do now?
You're fine. Oh, now you need a strawberry.
Okay.
How does your neck feel after that?
Like it's in 2 parts.
Is that good?
Good question.
Yeah, it's like it feels like it's bobbling on a point.
Ah.
It's what?
It feels like it's bobbling on a point.
It's balanced. It's not falling off at least.
As opposed to
That's not a bad thing.
I just want to know. Well, in India, it's definitely a good thing because if you're not bobbling on a point, you can't talk.
So what did you do just then?
I stretched out basically your scalings, but and he has, by the way, he has very, very tight trapezius. So that might be something also to look at. All right. How about the
So he's
You have strawberry and blueberry option.
a test.
Together it makes the chicken.
I can feel a little bit.
Hold on. One more strawberry. Is he making faces? Well,
Strawberries are nice. No, but seriously,
next
That was-
time
that was-
bring kale to teach him
No,
to eat
no.
vegetables.
that was better.
It is better, okay.
Yeah.
I would start looking at GB2. Okay, hold on, let go. Thank you. Let's try something. Okay, so before we do that, would you mind? Actually, I'm going to have you sit here facing that way so they can see what I'm dealing with, what I'm seeing. Yeah, that'd be great. Face. Yeah, sit facing there, so they can see it from the side, so they can see what's going on. 'Cause they're not seeing what I'm seeing, so they're confused. And then swivel around. No, swivel around to your left. So you've let
right.
me in.
Okay.
Now, do you see how his head's thrown back? And do you see how the trapezius is lifted up? When I lengthen the trapezius one way and send the skull, it's very hard to, he cannot let go here.
Yeah.
He said it's better. So I'm going to try and duplicate this with needles. Okay? So. Do 15, 16. And GB20 down. GB20 down. Okay. Not for me.
I'm okay.
No, but the eye.
All right.
Purely
It's not
for
because
medicinal reasons.
you're not being offered strawberries. It's doctor orders.
Part of the treatment, strawberries. You want strawberries and cream next time.
Yeah, well. How does it feel?
It feels. This is very weird.
Okay.
Right? The left eye and the right eye both. Hang on. Let me get the right words. Right. The right eye feels better, but something is also happening in the left eye.
And that's
But it's not a negative.
it's not,
but it feels
but it's not defined.
But it feels different.
Okay.
But it feels better.
Yeah,
as well.
it's bound to feel different. I mean, if things change in the body, things will feel better. I mean, things will feel different.
Right,
Sorry,
yeah,
my
yeah,
words
yeah.
all get mangled up. So yeah, it's unfortunately I can always.
Hang on.
Okay.
The tearing,
Mhm.
I would normally get a lot more tearing now
Okay.
from eating strawberries.
Okay.
So the amount of tearing that I would get at this point
Mhm.
from eating that many strawberries is down by about 50%.
Okay. Okay. Fair enough. Next time we try chicken. All right. So are you okay sitting here?
Yeah.
Or hold on, hold on. Let's get these out of the way. Thank you. You can actually lie down, just give me a second. Okay. Come back to, you can use your hands, come back towards me. Okay, and lie down. Or I was already pushing the needle to you, so the needle's not going this way. The needle's going, you're okay lying on it. Okay. You comfortable?
Yep.
You sure?
Yep.
All right. Okay. Okay, let's have you sit up.
Did you get the one out of my do
Yeah, I
two? My butt crack.
No, I leave those there.
Charge more for takeaways.
Charge more for takeaway, charge more for takeout. Either way. Leave them in, you charge more. You take them out, you charge more. Whatever you do, you charge more. All right. Are you okay?
Yeah.
Okay, let's have you sit up. And unfortunately, these strawberries are not going to entice anything in you, so we don't have a way to really test. Unfortunately, I tell you. But how does your body feel?
Yeah, good.
Yeah?
It took me a while to it kind of went through a wave, I went into the anxiety and then kind of had to come back out, but when I come back out, it was better.
Yeah. Good.
Thank you.
All right, thank you.
Get down.
All right, let's try and finish the lecture part. Oh, if we can just switch it to PowerPoint.
Can I ask, Abby? I see a lady who has a sort of similar sort of thing in terms of she can read something and she'll convince herself that maybe she's got it.
Yeah.
And then she'll have something on her lip and then play with it and think this is cancer. But her she's been like that for she says a long time.
Mm-hmm.
Would this be a similar approach?
No, the thing with her, the specific thing with her was she is postpartum and the damage to red 4. So I can't translate this to any kind of fear. But let's see if any of this here is going to evoke something useful for you. Let's see if this might help you get some ideas. Okay, so on the frontal hairline, you have these points. Okay, you have due 24, the Shen thing, the Shen courtyard. You have gallbladder 13, which is also Shen. You have, you can say you have bladder 3 or bladder 4, either way. So the only thing is that with bladder 4, the name is bent, and the second word is very hard to translate. Okay, it can be a difference, a discrepancy, an error, but it can also mean to dispatch. So I'm thinking, are they thinking of possibly something in, like synapses, dispatching things? I don't know, but it makes no sense. The character, the name of of bladder 4 makes no sense whatsoever. You have gallbladder 15, which is Lin Qi. So again, it has something to do. You can see how the Lin has to recline, and the Qi has to stand. So it's reclining and standing at the same time, it's the same character for gallbladder 41. Okay, so it has something to do with balancing horizontal and vertical. Okay, and of course you have gallbladder 13, which is the root of the Shen. Now, remember we talked about the stomach channel? Going like this from stomach. So basically we look now, stomach gate is called Toei, which basically means the corner of the head. Okay? So from the corner of the head, you're basically crossing these points to arrive at 224, basically taking all my sensory input into the brain. Okay? So this is, and as you know, the frontal cortex is basically how we interpret or, it's more, it's the higher sort of brain, quote unquote, okay, as opposed to the primitive brain. It's not about respiration and stuff, it's about ideas. What are our ideas about ourselves or whatever? So these things, just to look at that, because in a second we'll look at the side and they'll be a teeny bit different, okay? So here we're looking at the Shaoyang areas, okay? So you have more frontal Shaoyang, okay? You have the temporal Shaoyang, and then you also have the Sanjiao. You have the top, which we just talked about it, but then you also have behind the frontal hairline, and then you have the occipital. We already talked about the occipital, which is about making sure that I'm not blocking all the wind in the head, that there's a smooth flow of information. This has more to do with the primitive brain, okay, the occiput, and being able to, calm down the nervous system, but on a sort of more primitive level, so to speak. Okay? And, bye. Thank you.
I'm not going.
Oh.
Going out to craft.
Sorry. It's okay, you're welcome. And the top, again, is going to be about processing and interpretation. Okay? So how we interpret input. Now, in the front, we already talked about the Xuan, the suspension, to ensure the continuation of the consciousness is these points. While the temporal ones, the temporal lobe processes, sensory input. Okay? So, now let's look at the point names, and that's where you might get some ideas. But just so that you know, the truth is this is all gonna culminate in my Sanjiao 22, basically. Why? Because Sanjiao 22 is called harmony Liao. Okay, and so just to show you this area from do 20, let's say, to the ear. So this kind of the Shaoyang area is. It's a somatotope for the whole body, and once you get towards the ear, you can see that it gets to the face, meaning to our expression areas. Okay, and here's just another version of the same thing.
Abby, can you just go back to the next slide and essentially where the ear is?
Sorry?
Where's the ear?
Hold on. Well, the ear is below it. Okay, I think it might be easier from here. No, it isn't. The ear is sort of here.
Sorry, you pointed out your screen.
Okay.
We've got it.
This is your lower limb, your upper limb, your head. Okay. Your head is here, according to this somatotope. Okay. So the Shaoyang area primarily deals with the head, face, etc. Okay, with areas of expression. Does that make sense now?
Yeah.
Sorry. Okay. And this is the Yamamoto somatotope I. He has a bunch of other somatotopes. Okay. So you can see in the front you have your cervical spine. In the back of the ear you have your lumbar spine. You have your thoracic spine going up. In the front you have your arm, and in the back you have your foot, your leg. Okay. So, but remember, before you go and you use, like say, an ankle point or a hand point, check the cervicals, lumbar, and thoracics, according to the elbow. Okay? Cervicals, lumbar, thoracics, a little bit below lumbar 5. Then you can use any of those, and my suggestion is, leave all those alone if Sanjiao 22 is going to do it. If Sanjiao 22 does partial, then use the part of the cervical, either the cervicals or the lumbar or the thoracics that you want. Then you can use the body part. That's the my version of So now let's look at what I'm trying to show you is how important is the Sanjiao and the gallbladder, the Shaoyang is for. So these are just looking at the point names. So gallbladder 4 basically tells you the things that we like or dislike about what we take in, because the chin is how we take things in. Okay, so you can sort of interpret gallbladder 4 to be something to do with my capacity or my relationship to what I take in input, in sensory input. Gallbladder 5 and 6 we saw already have to do with suspension. Okay, so gallbladder 7 is the bent, and here, I don't really have a resonance with this name itself, but it is not the same bin as in Ju bin, as in kidney 9, but it's similar. It has the hair and the guest. Kidney 9 is just the lower part of, sorry, I'm pointing at the computer as if it helps. The lower part of the character is the bin in kidney 9. This is the hair, so it's the hair over the guest of kidney 9. So maybe kidney 9 and this have a connection. I don't know. Okay, and gallbladder 8. So when you see the not always, but you can when you see. So this is to lead, or the net. Okay, this is like inside. Sorry, I shouldn't be doing that. This is a net, like in Loa, and this is a container. So this is a net inside a container. Okay, that, but together it means to lead. Okay, where do you have nets? A network inside a container. You have that in a skull. You have a network of synapses. Okay. The character gu, if I add to yon or lacking to it, becomes you. Desires. Kidney 2 is called Rangu, the blazing valley. But if you think about it, kidney 2 is where we step on. If you have lots of desires, you're always going to push down because you're always desiring something. I think that often they use this character gu for you, for desires. Okay, so it's what kind of valley is blazing at kidney 2 kind of thing. But if you're looking at it as you're blazing desires, and then you can understand why kidney 2 is the fire, when it also happens to be fire point of the kidney. And when kidney 2 is painful, we say, oh, that's adrenal, meaning you have too much desires, you're running around too much. Okay, you're exhausting your adrenals. So you can, at certain situations, decide that gu might be a shorthand for you. Okay, so it's the network that leads our desires. Okay, so that can be like the synapses. Okay, so it's just different interpretation of point names. You can buy it or not buy it, but it's some sort of, Gallbladder 9. So the character Chong, regardless of how you spell it, because you can say there's 2 different Chongs in point names. Okay, and so anything that it literally says to, Chong is to surge or to charge. Okay, so what surges and charges? Synapses. Okay, so in other words, what I'm saying is that the gallbladder here, I think they're trying to describe synapses. Okay, and Tian is having meaning in the head, or okay. So, and here you have the floating white. Okay, so what other floating? If we're already on this theme, okay, there's a floating white matter in the brain, which is like the myelin. Okay. And this I don't have you can say, oh yes, it has the character intelligence and orifice and blah blah blah, but it's like I don't have a good description of gallbladder 11, and we can let go of gallbladder 12 also because it just means the edge of the bone. I don't have again a good metaphor. Now when we get to the Sanjiao, so this is we talked about the Ji Ma. The character Ji has the character for sickness plus a contract. So it's like you have a contract with sickness. In regular language nowadays it means malaria or madness or something like that. And Ma is a vessel or a pulsation. Okay? In my opinion, the translation that Ellis gives it, which is spasms or convulsions, there's 2 mistakes that are made, in my opinion, in that translation. Do you see this versus the heart character? This character is not the same as this character. The lower part is different. Okay? And if you take this character together, chi, not ji, chi, this becomes together is a convulsion. So I'm not sure how Ellis arrived, what the determination is. I'm sure it's not just Ellis, but you know, somehow this character became synonymous as if it's supposed to mean something else than it actually is. Okay? But if I'm just looking at the character, it's I have a contract with disease. It's the vessel of the contract with disease. Okay, so it makes it kind of like sound like an interesting point suddenly, as opposed to when we normally look at Sanjo 18 and we go, we don't even know where it is or whatever. Okay, and Sanjo 19, basically what it says is that these points here are going to calm the nervous system, because people who have contact with the disease are going to be kind of a little like this. Okay, which then you can say they can have spasms. And Sanjo 19 is the resting skull. Okay. And now we basically, so I told you what we're trying to do is arrive at Sanjo 22, which is the harmony in Yao. And the point about Yao is, yes, it's a bone, but it's not a hole. The second character has nothing to do with a hole. It's not a bone hole. Yes, a lot of them are on places where there's a dent in the bone, but it comes from the character to soar, okay? It's the wings that soar through. So anytime you see the character Liao, the assumption is that this is a point that can amplify, kind of like going through a conch. Sorry, I have all sorts of weird drawings. Okay? So, and a lot of these Shen issues or weird issues, this is it. Okay. A lot of these Shen issues start looking around here. And you can do it and you can do it for both for Shen issues and for pain. Because pain is a perception. And because you can sort of see, you can have a whole map of the body in this area too. So it's just something to, I'm just advocating use of it, but quite honestly, I just basically use Sanjo 22 for almost anything. Okay.
That makes it simple.
Sorry?
That makes it simple.
That makes it simple. It's always nice to do simple. Okay, let's lift you up. Come up. Okay. All right, how does it feel now?
Yeah, feels good.
Okay, good. All right.
Yeah.
Thank you for coming.
Thank you.
Thank you. Okay, questions? Yes.
When you talked about people who say things and you think, oh, that's a Chong disorder. Well, I've got quite a few patients who are they're going into the retirement phase of their life.
Yes.
And they can't stand it.
Okay.
And it's causing quite a lot of anxiety and depression, and they're already on that line. So, have I got to work on the final page?
If you're looking at 8 extras,
right,
to work with someone who's transitioning to retirement and has an issue with it, Chong will not be it.
Yeah.
Chong will have to do with what you were born with. Now, I can see how one. Sorry, I'm cutting you off, but let's see if I got it quite. I can see how one can interpret. I'm retiring, and talking about my alignment with life in retirement. That would be different, because it's not my blueprint anymore. It's my blueprint for now, but it's not the blueprint that I received from heaven. Okay? So, oh, sorry, I moved. Yeah. So I would say that would be, I would consider it possibly in the Yin Wei category, because it's transitions that we make in life. Transitions that are, say over, say a decade, every decade or so you make it. So retirement would sound to me a little bit more like one of those Yin Wei style things. Does that answer the question, or did I sort of interrupt it too early?
No, it fits. Yeah.
Okay. Any other questions?
Because Abby, I had no experience of this before coming here today. For me, going back into practice now, where would you, there's so much information in the last 2 days, which was great, but where would you advise that I start on a really kind of simple, just to kind of start getting to grips with practicing with my own clients using this?
So, yes, I totally understand. So what I would recommend, and I thought we sent it to people as a suggestion, and not that I expect people to do homework in advance or anything, but for the enthusiastic kind, I have a video on it's a PowerPoint presentation on all the reflexes, and so it's called Basic Horror Diagnosis. You can find it on my website, acupuncturemedical.org, and Eileen and I talked about that also. That we'll send you the link when as soon as I can email, I'll send the link to it, and then she'll email it to everyone. So that's, for 4 hours worth of watching, and if you really want to, you can just do the first, it's 2 videos, so if you do just the first video, it's say an hour and a half. And then I do one demonstration of palpation, so you can actually see it and then I'm trying to do it very dogmatic and very systematic. Okay, stomach 27, stomach blah blah, one by one by one by one, and then give you the official dogmas for releasing each one. But as you can see, what I actually do versus the dogmas are, I think I said something yesterday, I said something, my favorite kind of class is transcending dogmas. That's what I like to do. So I can tell you what the dogma is, and then I'll basically poo-poo it. Okay? So not because the dogma is going to work, because it doesn't become dogma unless it works. Okay? But the problem is we're in medicine. So our dogmas are not going to work 80% of the time. They're going to work 60% of the time. And in order for you to it's how do you milk more out of each system? You have to start being creative. Thankfully for us, thankfully for me, as acupuncturists, we're expected to do that. We're still not in the stage where there's standardized practice of acupuncture. When that happens, people like me will disappear because we won't fit in anymore. Now we sort of still can. But the people who want, to be creative and think, and each patient should, like the usual criticism of the research type thing. Well, research doesn't mean anything because every practitioner does something else. It's all, every patient is an individual. How can you research that this point is supposed to work on everyone? Well, maybe it does, maybe I don't know. But obviously it's possible to work that way. But it's so not the way I work. It doesn't fit the way
with what I do now. So
no, it's okay. But believe me, one day that method of working will disappear because it's not going to work. Because I heard on the news today that there's some company that Babylon, I think they're called, and they have some sort of artificial intelligence technology that basically asks all these different, gives you a questionnaire, you answer the questionnaire. I'm sure, don't think they take your pulse or anything, and then accordingly they say they can diagnose you at a 95% accuracy rate, which is better than the average GP. Okay, so it was kind of funny. Then this little machine says, I think I know what your problem is. Your problem is you have Meniere's. So, exactly. And then I guess then it sends a little electronic message to your pharmacy, and so you can pick up some drug for it or something. This is unfortunately kind of the future of medicine, is that it's going to be a lot of non-human interaction, and it's also safer in a way. Well, the computer says, the program says, or the Merck manual says, the people who work outside the manuals, they will still be around, but it's going to become a specialty, and people are going to seek you when everything else failed, kind of thing. So that's, so I'm teaching the protocol. I'm giving, the reason I did that PowerPoint is that so people have availability of the protocols easily, and then they can come and break them. So, but I will make sure that we have that sent to everyone. But that's what I would recommend to start there. Then once you've done that, what you do is you start with immune point, check against Sanjiao 16 or maybe against right stomach 26. See if they have adrenal reflex, which is just below kidney 16 both sides. So on the left side we call that 4 o'clock because it's like a clock. If kidney 16 is 3 o'clock and 9 o'clock, just below is 4 o'clock, 8 o'clock. And then you try, say, kidney 6 with kidney 7. From what we learned here, thank you. Lots of people have SCM, congestion. Try opposite Sanjiao 8. If that doesn't work, try Sanjiao 5. But the thing about Sanjiao 8 and 5 and immune point, I know lots of, the patient come and they want to have their arms here. They can't. They have to have the hand on the table. After you finish needling, because you can't find the point in this position, you have to find it in this position. And I know it makes the patient feel like they're crooking the shoulder like this. So fine, afterwards, place the arm on the, after you've needled, you can place the arm on the abdomen. Okay, but you're not going to find the point well if the arm is here. Okay, so releasing the SCM, so you're getting used to palpation kind of thing. People with appendix scar, for example, you saw have spleen 9. Spleen 9 resolves it. So anyone who has appendix scar or left or right side stomach 26, 27 pressure pain, see if spleen 9 will resolve it. It's not always going to work because right stomach 26, 27 does not always reflect just ileocecal. It can reflect immunity, it can reflect lungs, it can reflect a whole bunch of things. But that PowerPoint that video of that PowerPoint gives you kind of like all the basic protocols, bing, 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 and it actually, it's done twice. Once by area of pressure pain and once by ideology, by classifications. Cardiac, lung, this is where lung reflects. So once you see it from the body, and then you go through the whole thing a second time by classifications of body systems. So you have a better chance of retaining the information by basically, it's as if you watched the same thing twice without realizing it. So, all right? Anyone else? So let's take a 5-minute break, and then we have 1 more hour till 5:30, so we can choose to treat another person. I'm happy to help people individually on, on practice if you want to be palpated or palpate and see, so we can workshop whatever you guys feel is worth your while. Okay? So 5 minutes to gather yourself, figure out what you'd like to do next hour. Thank you.